Hi, my name is Anna Jordan, and I'm going to be talking to you about infusion nursing. So what is an infusion nurse? I asked some of the floor nurses that I worked with to tell me what they think infusion nursing is, and I got comments such as, oh, all they do is give medicine, or they're really good at starting IVs, or they just hang IV fluids. And so what is an infusion nurse? Well, they're nurses that specialize in giving medications through injections. Sounds simple enough. But these nurses are working one-on-one with these patients on a regular basis who are dealing with a chronic illness. Their primary role is to give these medications that allow these patients to live their life in an outpatient setting and not be admitted and have to endure another hospital stay. So their role is very important in managing these patients' chronic illness. So what are some of the primary activities for an infusion nurse? Well, according to the scope of practice from the Journal of Infusion, they administer medications. Of course, we know that. They're also titrating these infusions. Many of these infusions are for congestive heart failure, and they have a strong effect on the heart. They insert IVs. And while that sounds simple enough, many of the patients that they're dealing with may have undergone chemo or have been accessed so many times that it is quite difficult to access some of these patients. They have wonderful skills at doing that. They also access ports. Many of these patients who have to get infusions regularly have ports put in, and they have to have a good understanding of that and good care and good infection control when dealing with those. Lab testing is very common. Many of these patients have to get labs drawn with every infusion that they get. They also have to do cardiac monitoring. In the center that I was shadowing in, every patient is hooked up to the monitor as soon as they come in and are monitored throughout their infusion. It's very important with a lot of medications that they're getting. And also the vital sign assessment. They're hooked up through the entire infusion and receive vital signs every 15 minutes so that we're monitoring them appropriately. So what are some teaching and learning strategies that go along with the infusion nursing? Well, a large population of their patients that they see on a regular basis, like I said, are congestive heart failure patients. Many are seen multiple times a week or a month, and many have ports that make access easier for them. These patients need education on diet, which we all know is very important for CHF patients. So not only for their congestive heart failure, but also if they have a port, their diet's very important to allow us to access those ports and be able to draw blood from them. Medication education. These medications are very potent, and it's very important that we educate the patient on what to expect before, during, and after so that they're able to let us know if something's not feeling correct. Weight monitoring. This allows us to know their current volume status. Are they overload? What do we need to do? Are they needing more medication, less medication? It's very important to monitor their weights. And fluid restriction. Some of these patients are on fluid restriction to keep them from going into overload. And it's very important to educate them on decompensation signs and symptoms. That way they know in between treatments, if they're just not feeling right, they know what to look for to seek more medical attention. The other two groups that I found were very popular in the infusion center were cancer patients and multiple sclerosis patients. So the center that I was shadowing in no longer offers chemotherapy, but they offer the supplemental infusions for the cancer patients that the cancer center doesn't provide, and that usually consists of blood products. And with these patients, they need education on the products they're receiving, what to expect after, and also infection prevention. We understand that many of them are on neutropenic precautions, and we need to educate them on how to keep from getting sick. With the MS patients, they need to be educated on their medication, and with them, there's a wide variety of how they react to the medication and the different medications they're receiving, so they need to understand what they should expect directly after treatment and the type of improvement they can expect afterward and when to report to their physician how they're feeling. So what kind of educational preparation do these infusion nurses have to do? Well, obviously they have to be a registered nurse. But in the infusion center that I'm in, they also require BLS and ACLS certification. The center that I'm in does not have a physician in their infusion center. So it's very important that these nurses understand ACLS and can run a code on their own, because it does take time for emergency help to get there. Pharmacology is obviously very important. They're giving medication all day long, so they need to have a good understanding of the meds that they're giving, along with dosages, because it's important for them to always double check after the pharmacist to make sure that the correct dose and medications given to their patients. Heart rhythms, like I said, many of these patients are cardiac patients. You have to understand the rhythm and know what to do and how to titrate their medication accordingly. CHF indicators, like I said, as far as weight and cardiac rhythms. Infection prevention is huge. These patients are being accessed every time they come in, whether it be an IV, their port, central line. So it's very, very important for these nurses to follow strict infection precautions. And then an option, which is not required in the center that I was in, but is good for these nurses to have, is their CRNI certification, which is a Certified Registered Nurse of Infusion. So what other roles do these nurses interact with on a daily basis? Well, they interact with everyone. They're contacting physicians to get orders for these patients or let them know that something's not right. They're talking to pharmacy multiple times a day to order their medications and talk to them about dosages. They're constantly on the phone with laboratory about the labs that we're drawing on the patients, nutritional services, environmental services. They're talking to physicians' office staff in order to get all of the things they need for these patients, as well as schedulers who control scheduling for the patients, as well as billing and insurance. So it's constant interaction throughout the day with all sorts of roles. So what necessary skills should these nurses possess? Obviously, critical thinking. They're having to work on their toes to look at these medications and how they are affecting their patients and how to adjust accordingly. They obviously need to be experienced in venipuncture and port access. They need a strong knowledge of veins and blood vessels in the body. Strict aseptic and sterile technique. We know we don't want to cause central line infections, so it's very, very important that they follow these standards. They need strong communication and teaching skills. These patients are dealing with chronic illness, so it's very important that we're communicating with them and educating them on what they're having to deal with. Like I said, they need to be familiar with various IV medications, blood products, and fluids, and how to educate the patient on what to expect. They need to be skilled in infection control through catheter insertion, because, like I said, we don't want to cause an infection. And they need the ability to work with different types of venous access devices used for infusion, because many patients come in with different type of access, and we want to be able to utilize what they've put in place to make it most comfortable for them. So what are some unique facts that I found while shadowing in the infusion center? Well, I thought, it's not bedside nursing, it can't be that hard. That is completely incorrect. These nurses are doing wonderful things for these patients, and the knowledge and understanding they have to possess is just astounding. So it's very important for these nurses to build in-depth and long-lasting relationships with their patients. They're seeing them every day or weekly or monthly, and so they have to build that trust with their patient. ACLS, like I said, is very important because some of these infusions that they're getting have a strong effect on the heart and can cause fatal dysrhythmias, so it's very important that they can act appropriately. I was astounded to hear that some of these medications cost between $10,000 and $20,000 per bag, and so I just can't even imagine if they're very strict with not mixing or ordering medications until the patient is present, and it's just phenomenal to think that these medications cost that much. And then it's very, very important, like I said, to prevent inpatient hospital stays. That is their sole purpose, is to keep these patients at home, out of the hospital. And so that is a huge role for our community, decreasing inpatient stays and allowing these patients with these chronic illnesses to keep living a normal life. And so my stay in the infusion center was very enlightening, and hat off to these ladies. Thank you.